The calendar just flipped to November, and if you're counting on Social Security, there's something critical happening on the 7th that could affect your monthly income. Right now, millions of Americans are wondering if their benefits will reflect the changes everyone's been talking about, and more importantly, whether that deposit hitting their account will be different from what they saw last month. Here's what's actually going on. November 7th marks a key payment date in the Social Security Administration schedule, and with all the recent updates to SSA, SSI, and SSDI programs, there's genuine confusion about who gets what and when. Some folks will see adjustments, others won't, and understanding why makes all the difference in planning your expenses for the rest of the year. The reality is, the Social Security system follows a specific payment calendar based on your birth date and the type of benefits you receive. Whether you're on retirement benefits, supplemental security income, or disability, the November 7th date has particular significance depending on your individual situation. And with benefit amounts potentially shifting due to cost of living adjustments and program updates, you deserve to know exactly where you stand before that payment arrives. Let me be completely straight with you about what's happening with Social Security payments this November, because there's a lot of noise out there, and you need the facts. The November 7th payment date isn't some random day the Social Security Administration picked out of a hat. It's part of a carefully structured system that's been in place for years, and understanding how this system works is the first step to knowing exactly when your money should arrive and whether you should expect any changes to the amount you've been receiving. The Social Security Administration operates on a payment schedule that's tied directly to your birth date if you're receiving retirement or disability benefits. This isn't new information, but it's something that still catches people off guard every single month. If you were born between the 1st and the 10th of any month, your payment typically arrives on the 2nd Wednesday of each month. For those of you born between the 11th and the 20th, you're looking at the 3rd Wednesday. And if your birthday falls between the 21st and the 31st, your payment comes on the 4th Wednesday. November 7th falls on that 2nd Wednesday, which means if you were born in that first 10-day window of any month, this is your payment day. Now, here's where things get interesting and where a lot of folks start asking questions. Supplemental Security Income, or SSI, operates on a completely different schedule. SSI payments always go out on the 1st of the month. But here's the twist that confuses people every single time. If the 1st of the month lands on a weekend or a federal holiday, the Social Security Administration sends that payment out on the last business day before the 1st. So SSI recipients actually got their November payment at the end of October, which can make it feel like you're getting paid early, but you're really just getting it on the last possible business day before your scheduled date. The reason this matters so much right now is because we're in the middle of significant changes to Social Security benefits, and people want to know if those changes are reflected in their November payments. The cost of living adjustment, which everyone knows as COLA, is the annual increase that's designed to help your benefits keep pace with inflation. The COLA for 2025 was announced back in October of 2024, and it became effective starting with payments that beneficiaries received in January 2025. So if you're looking at your November 7th payment wondering if there's a brand new increase coming, the answer is that the COLA adjustment you're seeing now has actually been in effect since the beginning of this year. But that doesn't mean your payment amount can't change. There are several reasons why you might see a different number hit your account in November compared to what you saw in previous months. Medicare Part B premiums are one of the biggest factors that can affect your net Social Security payment. Most people who receive Social Security and are enrolled in Medicare have their Part B premium automatically deducted from their Social Security check. If there's been any adjustment to your Medicare premium, whether it went up or down, that's going to change the amount you actually receive. The standard Part B premium can change from year to year, and if you're subject to income-related monthly adjustment amounts, known as IRMA, your premium could be significantly higher than the standard rate. Another factor that can change your payment amount is if you're still working while receiving Social Security benefits. If you haven't reached your full retirement age yet and you're earning income above certain thresholds, the Social Security Administration may withhold some of your benefits. They review earnings records throughout the year, and sometimes they make adjustments to your payments based on updated information about your income. This can result in your payment being temporarily reduced or even withheld entirely until they recalculate everything at the end of the year. It can be frustrating, especially if you weren't expecting it, but it's part of the rules around earning income while collecting benefits before you hit full retirement age. For those of you receiving Social Security Disability Insurance, or SSDI, your payment schedule follows the same birthday-based system as retirement benefits. The November 7th date applies to you if your birth date falls in that first third of the month. But SSDI recipients face their own unique set of circumstances that can affect payment amounts. If you're going through a continuing disability review, or if there's been any change in your work activity, your benefits could be adjusted. The Social Security Administration periodically reviews disability cases to ensure that recipients still meet the medical criteria for disability benefits. And if your condition has improved to the point where you're no longer considered disabled under their guidelines, your benefits could be reduced or terminated. These reviews don't happen every month, but they do happen, and they can result in changes to your payment. Now let's talk about something that causes a tremendous amount of confusion, and that's the difference between getting your payment on November 7th versus getting it earlier or later than expected. Direct deposit is the fastest and most reliable way to receive your Social Security benefits, and the vast majority of recipients use this method. When you have direct deposit set up, your payment typically arrives in your bank account on your scheduled payment date, and it's usually available first thing in the morning. However, some banks process these deposits differently. Some banks make the funds available as soon as they receive the deposit information from the Social Security Administration, which can be a day or two before the official payment date. Other banks hold the deposit until the official payment date before making the funds available. This is why you might hear from friends or family members that they got their payment on November 6th while yours doesn't show up until November 7th, even though you're both on the same payment schedule. If you're still receiving your Social Security payment by paper check in the mail, your experience is going to be different from people who use direct deposit. The Social Security Administration mails paper checks several days before the payment date to account for mail delivery time, but there's no guarantee of exactly when that check will arrive in your mailbox. Mail delays, postal service issues, and even just the normal variation in mail delivery times can mean your check arrives anywhere from a few days before November 7th to several days after. This is one of the main reasons the Social Security Administration strongly encourages everyone to switch to direct deposit. It's faster, it's more secure, and it eliminates the uncertainty of waiting for a check to arrive in the mail. One thing that's been generating a lot of questions lately is whether there are any emergency payments or supplemental payments going out in November. Let me be clear about this because there's a lot of misinformation floating around on social media and in various articles online. The Social Security Administration does not typically issue bonus payments or emergency supplemental payments outside of the regular payment schedule. If you see headlines claiming that there's a surprise check coming or a special one-time payment, you need to be extremely skeptical. These claims often turn out to be either misunderstandings of how the system works, confusion between different government programs, or in the worst cases, outright scams designed to get people to click on links or provide personal information. What is true is that some people may receive back payments or retroactive payments if there's been a delay in processing their application or if there's been an appeal that resulted in additional benefits being owed. These payments can come at any time throughout the year, depending on when the Social Security Administration finishes processing your case. If you're expecting a retroactive payment, it won't necessarily come on your regular payment date. The Social Security Administration will send you a notice explaining the payment and when you can expect to receive it. If you receive an unexpected deposit that's larger than your usual benefit amount, and you didn't receive a notice explaining it, you should contact the Social Security Administration directly to find out what's going on. Sometimes the agency makes mistakes, and if they accidentally overpay you, they will eventually discover the error and require you to pay the money back. The relationship between Social Security disability insurance and supplemental security income is another area where people get confused, especially when it comes to payment dates and benefit amounts. Some people receive both SSDI and SSI, which is known as concurrent benefits. If you're in this situation, your SSDI payment follows the birthday-based schedule, while your SSI payment comes on the first of the month. This means you could be receiving two separate payments at two different times of the month. Your SSDI amount is based on your work history and the amount you paid into Social Security through payroll taxes over your working years. Your SSI amount is based on financial need and is reduced dollar for dollar by other income you receive, including your SSDI payment. So if your SSDI payment increases, your SSI payment will typically decrease by the same amount, assuming you're receiving both. When we talk about raises and benefits, we need to understand what that actually means in the context of Social Security. The annual COLA adjustment is the primary mechanism by which Social Security benefits increase from year to year. This adjustment is based on the Consumer Price Index for urban wage earners and clerical workers, which is a measure of inflation. The Social Security Administration looks at the change in this index from the third quarter of one year to the third quarter of the next year, and that percentage change becomes the COLA for the following year. The COLA that went into effect in January 2025 was determined by comparing inflation data from 2023 and 2024. So when you receive your November 7th payment, you're getting the same COLA increase that's been in place all year. There won't be a new COLA announced until October 2025, and that increase won't take effect until January 2026. However, individual benefit amounts can increase for reasons other than the annual COLA. If you recently reached your full retirement age and you had been receiving reduced benefits because you started collecting early, you might see your benefit amount increase because the earnings test no longer applies to you. The earnings test is the rule that reduces your benefits if you're working and earning above certain limits before you reach full retirement age. Once you hit full retirement age, you can earn as much as you want without any reduction to your Social Security benefits. Additionally, if you delayed claiming your benefits past your full retirement age, you earn delayed retirement credits that increase your benefit amount by a certain percentage for each month you wait, up until age 70. These credits are added to your benefit amount, and once they're factored in, your payment will be permanently higher. For people receiving disability benefits, there can be situations where your benefit amount increases if you have dependent children who qualify for benefits based on your work record. When you're approved for SSDI, your eligible children can receive a benefit equal to up to 50% of your benefit amount, subject to a family maximum. If a child becomes eligible after you've already been receiving benefits, or if there's been a recalculation of the family maximum, your household's total benefit amount could increase. These types of changes don't happen automatically with every payment, but they do occur when circumstances change. The bottom line is that your November 7th payment should be reliable and consistent with what you've been receiving, assuming nothing in your personal circumstances has changed. If you see an unexpected increase, don't just assume it's free money and spend it without understanding where it came from. Check your bank account carefully, look for any notices from the Social Security Administration in your mail or online account, and if something doesn't make sense, reach out to the agency directly to get clarification. The same goes for unexpected decreases. If your payment is less than you expected, there's usually a reason, whether it's a Medicare premium change, an earnings-related adjustment, or something else entirely. Understanding your Social Security payment isn't just about knowing when the money will arrive. It's about understanding your rights, knowing what you're entitled to, and being able to spot problems before they become serious issues. The November 7th payment is just one in a long series of payments you'll receive throughout your retirement or disability period, and being informed about how the system works puts you in control of your financial future.